Hi, I'm Dr. Terry Day. I'm one of the volunteer board members with the Head and Neck Cancer Alliance. And really one of the goals is to educate you and me on how we can find mouth and throat cancer early. And it's very simple. Any red or white patch that lasts for 2 weeks or longer, any lump or bump in the throat, mouth, or neck needs to be checked. And it's easy to get checked by a physician or dentist. You can even do a self-exam. Now, I have the advantage in my office of having a bright light and gloves and all this equipment, but you don't even need that. All you really need is a light. It could be a pen light, it could be a flashlight, it could even be the light on your phone, and then access to look in the mouth and feel the outside of the neck. So here's what we'll do. And thanks for being here today for checkup. And I'm just going to use tongue blades and examine the outside of the mouth, look at the lips, make sure there's no spots or lumps or bumps. And I'm going to examine all the way around. So I kind of work my way around clockwise, inside of the cheeks, the gums, around the teeth, and then I'll look up at the palate and then have them stick out their tongue and move it to the right side, the left side, and then I'll look under the tongue, one of the most common sites for mouth cancer, and then in the back and have them say ah. Ah. And oftentimes you can see the tonsils. Now, the other important part is to look and feel. And so always feel the outside of the neck, make sure there's no lumps or bumps, swollen glands or lymph nodes, and then examine the other side. And go all the way from the jaw down to the collarbone. And a great exam, no abnormalities found, and that's all there is to it. Remember, the key points are look for a red or white patch in the mouth, and if it lasts for 2 weeks or longer, it needs to be checked out. Any lump or bump in the mouth, the throat, or even in the outside of the neck, that could be the earliest sign of a head and neck cancer. And so that's what we're looking for. So remember, in head and neck cancer, it's important to be diagnosed early. And it's very simple. A free screening is available. You can see your physician or dentist and even do an oral self-exam. So you can go to headandneck.org and find out more about early diagnosis.